It is now, I believe, 8:30 exactly. Calling the meeting to order of the Wakefield Health Department. We'll take our roll call. Present, Laurel Gorbel. Cindy,
Laurel.
Laurel. Did you hear
Oh,
me?
I'm sorry. Aye.
Aye. Candace Linehan.
Hi, good evening.
Okay, and Elaine Silva here. Ruth Clay will be taking the notes tonight for us.
Maureen, you want to call to order the Melrose Board of Health? Unmute yourself.
Calling to order the Melrose Board of Health meeting. Present, Maureen Garapay, present. Carol
Present.
and Frank.
Present.
So everybody's present for Melrose.
Okay, so there's only one, oh yeah, public participation. Sorry.
Do we have anybody here from the public? If you wish to speak, if you could go one at a time and please speak your name, address. Is there anyone who wishes to speak, any public participation? Okay, we'll close.
I'm
public-
sorry, it took me time to unmute.
Oh, okay, we'll let you.
I'm not used to being muted, that's why. Steve Mayo, 2 Jackson Lane, Wakefield. I am speaking for myself, not for the town council. I want to make that very clear. Mainly as someone who is jaded and has stood at the front line as the bouncer for our clinics in Wakefield. So I want to give a little perspective for that. You know, Wakefield has roughly 2,500 seniors over the age of 75. Of that, I was pleased that 287 were vaccinated at the first clinic that we held in Wakefield. And since then, many have had been vaccinated elsewhere. And as you know, we have a second clinic coming up on 26th, I think. I don't want to get that name wrong. Is it the 26th? Yes, of this month. So we were kind of thrown a little bit of a curveball the other day, and I think probably you were as well, when the governor made his change for the state Massachusetts clinics. And I just want to point out from my perspective that the town of Wakefield, we're not like Fenway Park or Gillette, where, you know, caregivers are driving all over the state. You know, here our caregivers are coming to where our residents are all the time anyway and taking them in. And I think isn't the real joy of this is having your elder or your senior getting a vaccine. And once they have it, you know, they're safe. And I think, you know, the other people can can actually wait their turn to make sure our more vulnerable people get vaccinated. However, I do understand the other side of the argument as well. So I'm just asking for some, make sure we make it very clear, because we are advertising at least our Wakefield clinics locally, so we don't get inundated with people all over the state coming in like we did before. Number one, it must be very clear they must have an appointment. Okay, you cannot and will not get a vaccine. You just can't just show up, because that could cause havoc. As we know, we only have a limited number. You must have an appointment, and we'll need to make that very clear. Number one, it is one per, in my mind, one per person over 75. I got an email today from someone that said their parent had already had a vaccine scheduled in Wakefield, and she and her husband were the caregivers, so they would like to get in and also both get vaccines. So I don't think there can be 2 for 1, or we're really, you know, limiting what our seniors get. This is not for the second clinics unless you already came in on the first one, because we only have a limited number of shots, and that's doses, and that's limited to everyone who came in to the first clinic. We know they've arranged for a second clinic, and that's you know, by a private arrangement. and we can't all of a sudden have people showing up and then we're going to run out for our first clinic people. And in my opinion, I just thought of this and I can imagine that there will be people in Wakefield, and I'm just talking about Wakefield and Melrose too. We had set up this clinic for our seniors in Wakefield residents over 75. I think we have to be clear that it's wonderful that you're a Wakefield citizen and you're under 75, but that isn't the ticket to the over 75 person that lives in Brookline to come in under our, under Renew and kind of backdoor it that way. Those are my thoughts if the board wants to go that way, which is your perfect right to do so. I'm also very concerned about scams, and I think we've already seen them coming up out where people are offering their services on Craigslist and what have you. Doesn't take long, right? Offering their services to drive you to and from your clinic in order to get a shot. And they're not caregivers. They're just people taking advantage of a situation. And it seems to me that the science that I've read shows that those that are over 75 are our most vulnerable. They have the most highest mortality rate, I guess. Don't we want to make sure that the shots go to them and what have you? So that's my comments. There are mine and mine my own. Having kind of lived through this at the front door and having had a lot of phone calls and emails, and I know what's happening to people in the health department, people in our senior center who are getting the calls, and there's a lot of questions coming in, and boy, was it instantaneous. So those are my points, and I thank you for allowing me to speak, Madam Chair.
Thank you, Mr. Mayo. Is there anybody else? Ruth, did you want to review exactly so that those that are, you know, from the director's point of view and directors, what you actually were told and informed on these clinics for the unions?
Yep, sure. So before the meeting, I sent all the members of both boards the official announcement from the governor's office that outlined in detail what this is. It only technically affects the state mass vaccination sites because those are the clinics that the state runs. However, there is a local option, you know, for people, for businesses like pharmacies or local health departments or anybody else who's offering vaccination clinics to adopt the policy if they want to. The purpose of the policy is to address access issues for our most elderly who are less likely to have a driver's license, less likely to be driving, less mobile, and more likely to need assistance to come to the clinic. And the governor and Secretary Sutters has been clear that they don't want that to be a barrier for seniors to be vaccinated. I will just throw in here a piece of information that Wakefield is part of Mystic Valley Elder Services Home Care, and anybody who's over the age of 60, when that's appropriate, right now anybody over the age of 75, without any income limits, who needs assistance getting to a vaccination clinic, either ours or Danvers, can call Mystic Valley Elder Services, 781-324-7705. That's 781-324-7705. And they'll be given a round trip taxi voucher to get to the clinic. So if they don't have somebody who can help them, they don't want any barriers for our senior citizens to be able to get to a clinic. But back to the policy, that is the purpose of the policy, is to enable the person who's bringing the elder to the clinic to also be vaccinated. We know that there will be people who try to take advantage of that. The state is aware that people will try to take advantage of that, but at some point you have to trust people, and the minority that take advantage of it, take advantage of it. So for the 2 clinics that are coming up, there are, for Melrose, 760 doses available, and Wakefield, 702 doses available. The region divided it up based on population. So the 2 communities have approached this differently. Wakefield has it online as a private clinic. So when people go onto the state website, they can't register. They need to know the URL, which Wakefield is publicizing all over town in multitudes of communication methods. And so at this time, about an hour ago, where I checked, and there were 226 people registered. Only 3 were less than 75 years of age, and only 9 did not live in Wakefield. 5 of them lived in our collaboration, and so only 4 were outside of our region altogether. Melrose has it as a public clinic on the state website, and there are 480 people registered. However, I will say that I've been, I don't know what you want to call it, cleaning the data and going through, emailing people who don't live in Melrose, emailing people who are under 75, which the first time I did that was before the governor announced this, telling them that we would be deleting them. We'd be deleting their appointments because they were not eligible. And then I wait, if I do it at night, I wait till later the next day to see if anybody's emailing me because they have special circumstances. And then after that, I delete them. So of the 480 in Melrose, at least 80 of them are going to get deleted. So more about 400. So I can't do anything about the state website. However, it does, I checked them both tonight, both going on through the state website, as well as going on through maimmunizations.org. Both places say that they are for Melrose 75 and older or Wakefield 75 and older, despite the emails I'm getting from people saying we should have told them that. I don't know what else to say about that. So there are a lot of spots open. So for Wakefield, we have 450 slots open, and Melrose, about 350 slots open. So I'd like to use this as an opportunity to encourage anybody who's 75 or older who hasn't already been vaccinated to please register, because that's what we're here for. We have great clinic sites in both communities, and pretty easy to get through. You're there, you get observed, you go home. So I want to encourage everybody to do that. And I don't know if there's any other questions.
I don't know. Does anybody on the board from Wakefield have anything? Laura?
Yes. So, we have some logistic things. So one of my new phrases is, perfection is becoming the enemy of the good, because we are really tripping over all of this stuff. But I definitely take Mr. Town Manager Mayo's comments in stride, and we've already done an awful lot of work going forward. And we were very impressed with the amount of people who in fact did bring folks who needed some assistance. So it's a terrific, it's a great idea, except for, we're in scarcity and people are prone to misunderstanding. That being said, I think people, hear the bigger state message and the nuances already of our smaller private clinics that are only in our community, it's really hard to have different messaging. Um, one of my concerns is that we already have people who accompany their parent to the February 1st clinic and are assuming that when they bring them 3 weeks later for their assigned thing, that they then can get their first dose. Now, I did reread the state's instructions around this, and those people would have to understand that Wakefield won't know if, we can have that subsequent dose too, but they could go to another site. And in fact, it sounds like the state has accommodated a drop down that says, I have already received one, so I'm due for two. And luckily, that's the beauty of the electronics, is as hard as they are to input ahead of time. So one of my thoughts is that, we have a very defined amount of doses for dose 2. And I worry that implementing and opening that up is going to short the people who are due their dose 2. Now,
So Laurel,
Yep.
The PrepMod system has some actually good advantage parts to it.
okay,
And one of them is it has a message board, and we can easily send a message to everybody who's registered for the second dose and remind them that caregivers are not eligible at
Okay.
this clinic. And the reason for that is we are given the same number of
Right.
doses for the second clinic. I'm kind of explaining this to the public.
Yep.
We're given the same number of doses for the second clinic as we receive for the first clinic. So, we can't do anybody at the second clinic that wasn't vaccinated at the first clinic. And we can communicate that, I think, very effectively I can send a message board email out to everybody who's registered and remind them of that, and then give them some other options.
my only fear is that some people may then go to a state. I mean, we'll know because of who signs up, but I'm wondering if the behavior then, or the workaround, is that someone says, fine, I'll bring my person to a state clinic that will vaccinate the caregiver, and then that's going to have a weird impact on our dosing. Though we have learned our lesson in regards to how to store things a little bit longer, so that we're not beholden to that big number, that we can break it down and manage vaccine in case that does happen. I'm just wondering if that might be the workaround. And our bottom
Well,
line is we want to get more 75-year-olds in.
For the 75 and older clinic on February 26th, we have 702 doses, which
Right.
at this time is more than enough to be able to accommodate caregivers.
Okay.
So
Thank
that,
you.
I
That's a
don't,
good point.
unless there's and I've checked with my counterparts in our region who are, having similar clinics. All of us have relatively slow signups.
Okay.
We do know that a lot of people have been being vaccinated through their primary care physicians. Danvers is not that far away, so a lot of people have gone to Danvers and elsewhere. So I don't see a problem accommodating caregivers at our clinic where we're vaccinating 75 and older.
Okay.
But we cannot accommodate caregivers on February 22nd when we're doing our second doses.
Okay.
I agree with you, Ruth. And I agree, Laura brought up the fact, I felt that if we really and truly if we use so much of it, and we do have another big, huge population coming up, and we want to make sure that the vaccine comes in for the next group. And I think, Ruth, that one thing I really got very clear from listening to some of the newscasters and some of the people, actually clinics, that people were able to understand finally today that if they already had an appointment, like those coming up at our 22nd, they're already made, they're already accounted for. You can't change that count. You just can't do that. And we have to be assured that those people, we want to make them get their second dose. So I do think that maybe going forward, where you feel that the enrollment so far and the signups are lower and we'll have enough, that then we could adopt the state policy to have one caregiver. And as long as they make an appointment. And
Right.
it wasn't really brought out on TV. One other thing that I kind of thought of was if you couldn't get an appointment at the exact time that you were bringing your person that you care for, that you should make an appointment for yourself as close to it as you can. And then I just thought about it, if they didn't do it right away and then their person had an appointment at 8:30 and they have one at 10:30, are they going to stay around and wait for that, or will we be able to give it to them? I know our clerks have been phenomenal and our nurses to give it to them when they're right there. But with
Right,
that,
we've had that, yeah, we've had that in past clinics, when spouses sign up separately, and we always tell them, come together. One, we'll vaccinate both of you at the same time, and it has not been a problem.
okay, thank you, Ruth. Is there anyone else from the Wakefield board that has something? Candace? I don't know where she is. She's there.
Hey, Maureen?
Yeah,
I'm sorry.
I think I would just echo Elaine and Laurel. I know you guys have had hands-on experience at both of the clinics, so I trust your judgment.
Thank you, Candace. There's no one else.
Okay, Maureen, you're on. You need to unmute yourself.
Sorry, I lost you. I have a question. Did you say that the Wakefield is only for Wakefield and Melrose is only for Melrose?
Correct.
So these are not open to the 6 communities?
At this time, no.
Okay,
If there's, if we're close to the date and there's extra appointments, I don't see any harm in that. We certainly want to use the vaccine. But at this time, all 6 communities are doing within the next 2 weeks clinics in their communities for their residents 75 and older. We had a lot of feedback from Council on Aging directors that this population did not want to travel to other communities and that they were best served and most accessible for them by staying within their own community.
okay. I didn't understand that.
That's why we didn't do it the other way.
Okay. So I have not been hands-on at all, but hopefully will soon. But I mean, Ruth, you're the expert and you know what your doses are. And if you think that we can handle it, I'm all for that. I think honestly, if we, with the number of clinics that we already have, we're getting into March, and hopefully by then they'll lower the age and we won't have to worry about it anyway after that. So, for the next couple of clinics, if you think that you have, certainly have enough vaccine, I'm fine with that. Is Frank or Carol Ann, do you have any comments?
I just had a question, just a clarification. The 75 plus is a separate date than the second round of vaccines. Is that right?
Correct.
Okay,
So
that was,
the second dose, I didn't bring my calendar home with me. I have a separate vaccine calendar. So
the 19th, I think, the second dose.
is the second dose. The 17th are first doses for people over 75. And just to be clear, if people see activity at Memorial Hall this Saturday, those are second doses for first responders.
Mhm.
First responders only. So It's not been advertised to the public or anything because it's only for the first responders, and it's their second dose.
And I think just for the public who are on, it was a really good plan. This is sort of an example of how smart it was to do 6 communities of first responders, because we are hearing in the younger fit set, not so much the older patients, but we are hearing of some second dose reactions that have put people down for a day. So it was really well planned to make sure that we had all 6 communities staggering so that our workforce could be staggered. And so they're shorter and they're tighter clinics for that reason. That was our starting group. And that's not going to be the model going forward when we do the greater population, but that was an important consideration for maintaining our first responder wellness over time. So I just wanted to put that out there.
Yeah, there are 4 clinics this week: Tuesday, today, tomorrow, and Saturday in different communities.
Yep.
Wow.
So I will just say, and I hate to be the cynic in the crowd, but I know that at Melrose Wakefield Hospital, there have been instances of doctors showing up with people saying that they were their staff and they all need to be immunized, only to find out that they indeed were not their staff. So we just have to know this is human nature. The honor system doesn't always work, and people are going to try to get away with stuff if they really want to do it. I think that this idea is a great idea. If we have plenty of vaccine to go around and we're, washing it, that would be great. We can give it to the 75 plus, we can give it to all the people with them, and life would be wonderful. But I think it is, there's going to be some people taking advantage of it, unfortunately. And the cynic in me also asks, I remember the Wakefield first clinic was in the middle of a blizzard, a snowstorm. So
Yes.
if people were able to get to that one, I'm willing to bet they were able to get to the second one, just saying. Having said all that, yes, if we have enough vaccine, yeah, let's give it. So yeah, if we can do it, and again, Ruth, I trust your judgment. If we can do it, if we have enough vaccine to go around, let's give it to everybody. I had at least one patient tell me that he wanted to accompany his mother to Melrose Wakefield Hospital, and they said that they weren't going to be able to do it. They didn't have enough vaccine, or for whatever reason, they were not able to give the caretaker a vaccine as well.
Right. So that is up to each location to make their own decision.
Right. So if we have enough, that'd be great.
Maureen, do you want to ask if there's anybody from the public for Melrose to make any comments? We're kind of doing it backwards, but that's okay.
If there's anyone in the public watching this that wants to make a comment, I can't tell who they are, so just
They can raise their hand electronically.
raise your hand, I guess.
I see no raised hands
Nope.
and no comments in the comment section.
I do
That
see Mayor
would be
Broder
good
on.
for the public.
Mayor Broder, did you have any comments?
No, you guys are doing a fine job. Keep up the good work. And certainly I want to thank my Melrose Board of Health, but I certainly want to share the love with my old friends in Wakefield as well. And, I hope we do this thing.
Okay. So we'll need 2 separate motions, one from each board. I did send a
Yep, I'm looking.
draft motion.
Yeah, I don't have it.
Somebody from Wakefield want to make the,
Yep, I'm just pulling it up.
pulling it?
So I am going to change it a little bit though, to make sure that when it's effective. So this is Laurel Gorville, Wakefield Board of Health. The motion is to adopt the Massachusetts Caregiver Companion COVID-19 vaccine eligibility effective February 26th, which will mean that it will not be effective for the prior second dose scheduled clinic.
Roll call. All in favor?
Second, I'll second that motion.
Candace.
Second that. Thank you, Candace. All in favor? Laurel?
Borville, I.
Candace,
Linehan, aye.
and Silver, aye. No one's opposed, so go forward with that. Melrose?
Does someone want to make a motion?
Yes, I'm Carol Ann Lisitra from the Melrose Board of Health. I make a motion to adopt the policy, Massachusetts Caregiver Companion COVID-19 vaccine eligibility, effective the date I believe you said was
February
February
17th.
17th.
Yep. Somebody needs to second it.
Oh, second,
Okay, all in favor? Carol Ann?
Yes, I.
Frank?
Vanchero, yes, I.
Garapay, yes, aye. That's 3 in favor.
Yep, perfect.
Thank you.
As an emergency meeting, this was the only thing on the agenda, and I appreciate everybody's accommodating a 24-hour turnaround. It's the only thing really that can be discussed tonight because of the emergency nature of the meeting. We do have regular meeting, I think it's next week, already scheduled.
Okay.
So.
Okay, do we have a motion to adjourn?
Motion to adjourn the Wakefield Board of Health meeting?
Oh, wait, hold on.
Okay.
We
Somebody?
missed Tom Walsh wanted to say something.
Oh,
I'm sorry. Didn't see him. Sorry, Tom.
A little slow on the draw. Go ahead, Tom.
Well, I guess it's a moot point now,
Oh, sorry.
but I thank you for recognizing me. I'm a numbers person, and what I wanted to bring to the table was the fact that when Wakefield did the first vaccination, we did 287 people, 75 and older. That's how many we did.
Right.
Before we had this meeting, we had a meeting, Steve, Ruth, and myself, and I went to the town clerk, and I found out that we had over 2,000 residents in the town that were 75 and older. So even if we had the 287 and the 700 that we would have if it was just strictly for the 75 and older, we'd still be about less than half of that left to do, more than half of that to do, and would mean at least 2 more clinics, which means 4 if we're given 2 doses. And I thought that we should probably have left the caregivers out this time around to get to those people. Because first off, we're trying to do as many Wakefield people as we can. And I'm sorry for the Melrose people who listen to this, but, and my thing was, you know, the caregivers, when they come in, not all of them are going to be Wakefield residents. So we're going to be inundated, and we're going to carry this further unless all these other people that we haven't got yet that are in the town are going to some other clinic, one of the mass clinics, and getting it done, or they're going to the doctors. But you know, the governor can do whatever he wants to do, but he controls the vaccine. We only have a finite number, and I was hoping that we kept it to our town and Melrose keeps it to their city and took care of them first. The reason that they are first is because they're the most vulnerable. They're the ones who are going to get the most sick or have the ability to pass away. And the average age of the people in this state that pass away is 81. So the longer we extended out our vaccination clinics, the more chance we're going to have that these people may get seriously ill or die because they're still waiting for a shot. I hope that's not true, but these are the things that I think about when I'm looking at the logistics of it when we do it. So, you know, all well and good, we're going to go forward, but these are the things that I think about, you know, and the real numbers. We still have, and we're going to have 3,000 behind that on the 65 plus.
So thanks, Tom. And I probably should have said this earlier. And I think you came in a little late, but I don't know if you heard me say that all 6 communities signups are much lower and slower than we expected. We thought there would be a mad rush for all of the spots. It hasn't happened. The Wakefield Council on Aging Director contacted 35 Wakefield residents over the age of 75 over the weekend who she had on a list would have difficulty registering themselves, with a computer. And of the 35, 25 already had either been vaccinated by their primary care or Danvers or had appointments. So out of the 35, only 10 needed appointments for next week. So that's essentially a third, not technically, but approximately a third. So I share your concerns, but it seems that a lot of our seniors, Melrose Wakefield Hospital is vaccinating 450 people a day, and a lot are going to Danvers also. It seems like after this clinic, our 75 plus will be well vaccinated. I'm hoping that's the case because, 226 people, there's only 4 at this point that I know I'm kicking off. So that's 222. And that's, another 500 doses left. So I think we're going to be okay. No guarantees. I have no crystal balls, and I absolutely cannot predict human behavior. But I think we're going to be okay.
Ruth, let me ask you this. If we move on to, I understand where Mr. Welch is coming from, to go on to the next group. If you had one, say somebody who was 76 or 77 and somehow or other did miss, everything and didn't get it, and there was the 65 and over clinic, if they registered, would they be able to register? So even if they missed it, they would have another opportunity down the line. We wouldn't refuse them.
Oh, absolutely. At the mass vaccination sites, anybody who's in phase 1 or this first group of phase 2 is eligible. In this case, the 6 communities said we really wanted to prioritize the most vulnerable, 75 and older, and we had already had regional clinics for the people in phase 1. So we've been telling unvaccinated phase 1 people who still want to be vaccinated, we give them the other locations, the mass vaccination sites, because we really did want to prioritize this clinic specifically and maximize the spots for our 75 and older.
Thank you, Ruth. Do we have a, thank you, Mr.
Wait,
Wall.
I have one more question for next week, homework. Does MIIS, the Massachusetts Immunization Record Keeping System, can you do a search on zip codes? Can you do a demographic search to sort of get a sense of how the population is doing? You would think.
No, I don't believe so. You usually can only go in if you have a name and a birth date.
And I have an answer for that. I was on a call. Actually, Mayor Broder and I were on a call yesterday morning with the Lieutenant Governor and Secretary Sutters. I think it was on that call, or it could have been on another call. I don't know, been a lot of calls. But that issue has been raised with the state that locals would really like to get some more local data. And they are working on that, whether it's through PrepMod or through MIIS, but they are working on being able to give us local data that way.
Okay, that would be really helpful for planning.
Also in the works is a way for us to, using the word clone, but essentially clone the first clinic so that people don't have to re-register for the second clinic. So again, that's been feedback we've been giving, and they've listened and they said they're working on it. Obviously not going to happen overnight, but they understand that that is something that needs to be changed in PrepMod. But within the clinic on PrepMod, I can run any kind of report I want. I can sort it by address, by age, by, pretty much whatever I want.
Yeah, that's super helpful, but speaking to your earlier point, we really need to get a sense of who's being vaccinated in different places so that we know, so we can anticipate how we can move
Absolutely.
most efficiently. So we're going to do the best we can. I just want to remind people that it is not an easy task to keep up with these rules. Please be patient with us, and we're trying to be fair and get as many people vaccinated as we can in a reasonable and safe environment.
Can I ask one question
What?
before you adjourn?
No.
Madam Chair, can I? Is Elaine?
Elaine.
And of course, you can ask any question you would like.
Thank you. So it is, just because we're gonna have to message this, it's one caregiver per person. Is that correct?
Correct.
All right. And are we still saying that the over 75 person needs to be from Wakefield?
Yes.
Yes,
Okay.
that's correct. It's a
We may,
Wakefield.
and we may change that when we go forward, but, okay.
But
Because
this is who we're vaccinating.
excellent communications director on, and I know she's gonna make some changes.
Yes.
And I'm looking at her right now, so she knows what's going on.
I actually had a question too, just for my own knowledge. Is it a caregiver only for someone who is over 75, or is it when we move on to a next group, if there's someone who needs assistance, does that also apply to them once other groups are opened?
Well, that will be completely up to the governor. And right now, it's only this group. But as we've seen, changes are made along the way. So we'll see what happens with the next group.
Okay.
It's possible.
Well, tremendous job by you guys. I know it's not easy, but perfection is the enemy of the good, and we're about as close to perfect as you can get. So
Well said. Well said, Steve.
I agree. Can I have a motion to close the meeting then for Wakefield?
I'll make a motion to close the meeting for Wakefield.
Second.
Candace second. So we'll close it at 9:12 p.m.
Our next meeting is next Wednesday at 7 p.m.